All right, so here we have our patient. We can click on this patient name here to get into the chart. And now here's our chart. This is kind of the general layout. Here we have our name up top, last name, first name, the medical record number, what bed the patient's in, their age and their date of birth, their weight in kilos, and also includes their height. That chief complaint that we saw before, here are some orders. Here is their vitals, and this is going to be the latest vitals, okay? So that's going to be important to know. And then you'll see here on the side here, we can kind of take a look at the rest of the chart. Now here's the triage. So this is going to be completed by our nurses here. Chief complaint abdominal pain. A lot of times our nurses will have a little bit more detail than that. And that will include a lot of really great information about why the patient's here. Sometimes there will also be a preliminary statement or preliminary note by our physician's assistants that will include additional triage information as well. Here's vital signs, and this will be a whole list of vital signs versus just up top here, which is the latest set of vital signs. So if you want all the patient's vital signs, click here in the vital signs section. Now here would be past medical history. A lot of times this is filled out by our nurses, but you can click that as well in order to fill out that information. So once we click on that bar there, our past medical history pops up. And here we can include information about the patient's past medical. And basically this is just like click boxes. Left clicks right here, left click for no relevant information. We can click out the patient's social history. Do they smoke? Do they smoke cigarettes? Their alcohol history, their drug history. That can all be included. And then their family history as well, you can click on that. Now as we get towards the bottom here, if we want to look at our nurses' records, we need to make sure that we say that we reviewed those and whether we agree with those records. And then really important down here, sorry it's falling off my screen, but this enter. You need to make sure that you enter here because that's going to be really important to make sure that this information sticks. So it's really a shame when you do all that work and then if you click to another patient or you go look at something else in this patient's chart but you don't press enter, then you lose all the information that you used. And that's going to go for everything that we do here today. So got to click that enter button. And that just kind of takes us to the next thing. This is the review of systems, but it's the next thing on that list. But so you can see how we went from past medical history to review systems. Say we wanted to change something in that past medical history. They actually have a history of coronary disease. We can click on this part of the medical history there. It opens up. We are able to click cardiac disease, take off past medical history, and click change. And that introduce that change into the past medical history without having to redo everything, which is nice. Now, if we want to fill something out for this patient. They have abdominal pain. We go to HPI right here, and we can click abdominal pain. Now, there's T-sheets, more or less, like electronic T-sheets for a bunch of different complaints, as you saw. So here, our history of present illness, we can click in this box, and we can write a little HPI. A lot of times there are clicks, and Pisces will allow you kind of to click through as you go. And that will give you able to almost formulate in HPI. But a lot of times, especially since that ends up speaking very computer speak, a lot of us write a little HPI in kind of normal medical language ourselves up at the top here, as you see that I'm doing. Then we kind of go down through the click boxes. And it's going to be left click for something that's positive or that we agree with, and right click for something that you don't agree with or negative. So the patient has abdominal pain, left click. We got this story from the patient. It's localized. And again, you could just go down the list in terms of what's going on with the patient and fill that out. And a lot of this is just click and drop boxes, left click for something positive, and you saw how I right clicked there as the pain did not radiate. And you can just go down these lists here to fill out what you want to fill out. And then the associated signs, this is where you're going to use a lot of that right clicking to say that they don't have whatever you're right clicking for. Okay, and then really important, just like we always talk about, is the enter button at the bottom. You could lose all your information, again, if you click on something else and you don't click enter. Now we've already filled out our past medical history there, and we can see it. If we click that little arrow there, we were able to expand everything that we already saw, and now we're in the review of systems, and we can click through that. Again, another place where you're going to do a lot of that left-clicking for something positive, right-clicking for something negative. And then you can just go down. Some things will auto-populate from your HPI. Just be careful, because sometimes you just want to make sure that you're actually documenting accurately, especially if you're going to use the all systems reviewed as a negative above. You want to make sure that that's accurate. For some reason, if you weren't able to review all the systems, say the patient's intoxicated or demented, or they're really unstable, they mental status changes, you can just click that their reviews were not, you're not able to review it, and why you were not. And then remember enter, like we did before. Also, I just want to draw your attention to everything that we're doing here is getting timed. So whatever time you enter on the chart right up top is the time that it kind of gets put into the chart, that you entered it at 1440 or whatever time that you entered it at. And basically you can start clicking down here. This is very, again, similar, click boxes. For some of the things you can click all the above, and that will make all the above positive. But you can basically just click down, again, left clicks and right clicks as needed in order to fill it out. See how I put cardiovascular assessment normal? Don't do that, because that actually doesn't really properly document things. So you want to actually document each individual thing. Even if the cardiovascular exam was normal, you want to click regular rhythm and heart sounds normal. Now for the abdominal exam, you can click through that as well. Now if you end up doing a rectal exam, you can click off those things. Something that's pretty important is if you do a Hemoccult test, say it was negative, you want to say the control was positive. That just shows that you properly documenting the Hemoccult test itself. Just make sure that you do that. Now your GU exam, you can fill that out. And basically this physical exam is just, again, just like what we've done before, left and right clicks as needed. And see how I clicked that all of the above and all those popped up. And remember our very important enter button, so everything sticks. Most of our patients at least get one pulse ox. So whether they have a single pulse ox reading or if they're on the continuous monitor, you can document that. So document what their pulse ox is as well. And then enter. And that's going to bring you to the next thing, and as you can see. So here that we've kind of documented a good amount of stuff here. Here we see the doctor tab, so that's going to be for procedures. If you click on that, you'll see a lot of templates for procedures. HPIs, where we talked about, where we got the templates for the chief complaints, the history, present illness, and score. We just clicked on that, and that's bringing up kind of what our score for this patient. And we want to build to a level of 5. This is not as important, but I do want to make sure that you're documenting properly. So the history, present illness should be extended, review of systems be complex, or past medical history complete, and the physical exam complete, and that should be a level 5. So if you want to, after you finish all your charting, to make sure that you have all the components that you need. I just clicked on results, and that brought up some lab results. This will bring up labs as well as some imaging. And then I click results again up top, and this brings it into a new area, a new page. And so you can see all the patient's results here in the ED. We can click this little button here, and that highlights our labs, and then we can click enter on the chart, which is great because now we've put it in our chart. And if we open up this tab by clicking that little caret, we can see all the results in the chart. And this is going to be important just because, one, it enters it on the chart, but number 2 is if the patient gets discharged, those labs and all the imaging, everything you did for the patient will get entered onto their discharge paperwork as well, which is very helpful, obviously, for the patient and their continuity of care. So that's kind of the beginning of how to document. In the next video, we'll kind of talk about a few other things, and then we'll talk a little bit later about placing orders, admission requests, and we'll talk about discharging patients.